This is my DDS presentation. So my patient is Mr. Neighbors. He is 59 years old, and in regard to his vitals, his blood pressure is 128/82, which is considered stage 1 hypertension. He has a pulse rate of 88, which is within normal limits, and his respiration is 16, which is also within normal limits. His chief complaint is that it's been a while since he's had a dental cleaning, which may indicate that he has dental anxiety. However, he does state that he does not have any nervousness about treatment or issues with the dentist. But just in case, we would want to make sure that he has no signs of anxiety. His stable angina and recent heart attack qualify him as ASA 3. In regard to his medical history, he's had a heart attack within the last 5 years in 2015, so I would want to make sure that he doesn't have a pacemaker. He has stable angina pectoris. He has controlled type 2 diabetes mellitus, hyperlipidemia, depression, and a history of stomach ulcers, which may be caused by his medication Warfarin, because that is a side effect of that medication. He has a history of hypertension. I would want to make sure to question him about when he was diagnosed with the condition, and also multiple of his other conditions. I would ask this too, because it is not stated in his medical history. His last medical examination was April 5th of 2020. So this proves that he is under the care of a physician and is receiving regular guidance, which is great, and it proves that he has places a high value on his systemic health, but it seems that he does not fully understand the importance of regular dental treatment. He drinks beer, wine, and hard alcohol socially, and I would want to inform him that this may be an issue in combination with his hypertension, because too much alcohol on a weekly basis can increase his blood pressure even more than it already is. In regards to his medication, he is taking 9 medications and he is not taking any vitamins. He's taking Warfarin. So for this, I would make sure to assess him for symptoms of blood dyscrasias, which can cause infection, bleeding, and poor wound healing. He is also taking rosuvastatin, which there is no oral side effects. He is taking clopidogrel, which has no oral side effects. Metoprolol, which an oral side effects for this is xerostomia, altered taste, and poor wound healing. He is also taking paroxetine, and the oral side effect of this is xerostomia. He's also taking lisinopril, and xerostomia is also an oral side effect. Glipizide, which is a side effect, is altered taste, and also I would make sure to assess him for blood dyscrasias. He is taking furosemide, which xerostomia is a side effect, and I would also assess him for symptoms of blood dyscrasias. And he's also taking nitroglycerin, and some sublingual side effects are burning and tingling sensation, and also xerostomia. So for all of these conditions, because many of them, xerostomia is a side effect, I would make sure to assess his salivary flow. And a lot of these conditions also have nausea and vomiting as a side effect too, so I would make sure to assess his oral cavity for any erosion that might be there. So in regard to his dental history, he has multiple extractions, a dental implant, crowns, and he has a root canal treatment, which indicates that he does have a history of caries. He has not had a prophylaxis since 2016, and I would ask why he has not been to the dentist in 4 years. His last bite wings were in 2016 at his appointment. He does not have fluoridated water. He is getting it through his toothpaste, although I would suggest that he is getting either purchasing a water bottle that has fluoride in it. Right now he's using Evian, which does not have a significant amount of fluoride, or I would suggest buying fluoride tablets for his home water system or the water bottles that he is buying currently. He brushes his teeth twice a day and places high value on his teeth. He clenches and grinds at night. However, he doesn't wear a night guard, so I would recommend that he is fitted for it during the appointment. And he is also unaware of how to check for oral cancer, so I would make sure to teach the patient how to do so and how often. And then make sure I pay close attention to his oral mucosa, palate, and tongue for any lesions. So as far as his beliefs, for him it is important to prevent caries, gum problems, and other diseases of the mouth. He wants specific product recommendations, which is great. He believes that he has control over the condition of his oral cavity, and he states that his eating habits are under control, but with his condition of hypertension and all of his other systemic conditions, as well as his high risk for caries, I think that he might be ill-informed about what good eating habits are. So in regard to his dietary analysis, he had a few deficiencies of calcium, vitamin E, vitamin D, magnesium, copper, folate, zinc, B1, omega-3, vitamin K, water, fluoride, dietary fiber, and carbohydrates. And he also had excesses of vitamin A, phosphorus, saturated fats, sodium, and sugar. So I would suggest that he increases products such as dairy, salmon, fish oils and plant oils, whole grains, legumes, and nuts. These foods are significant sources of vitamin D, calcium, fluoride, copper, and magnesium, which affect the mineralization of bone and also the health of the periodontium. Also, whole grains are a good source of vitamin B1, and if you are deficient in B1, it could lead to depression. So I would suggest that he does increase his B1 on a daily basis too. Salmon is good for omega-3s and fluoride, and legumes and whole grains can increase his dietary fiber. I would also advise him to incorporate at least 16 more ounces of water per day. He was only getting, almost every day, he only got 8 ounces of water. I would have him limit his red meat, egg yolks, leafy green vegetables. These are sources of vitamin A, phosphorus, and cholesterol, which he has excesses of. So I would also advise him to limit his alcohol intake by 1 drink per week to hold him accountable, to make sure that no issues with his other conditions are occurring, because he has hypertension, hyperlipidemia, depression, a dental implant, xerostomia, and several medications that indicate that alcohol should be avoided. So for these, I would definitely emphasize the limiting of his alcohol intake. I would also have him limit his sodium intake by 20% by the next appointment because of his hypertension, hyperlipidemia, recent heart attack, and his angina pectoris. I would have him limit his sugar intake by only having 1 juice box a day instead of 2, as he was doing for the 5 days. And also, he would have 2 cookies per day sometimes, so I would advise him to just limit that to 1 per day. Also, I would advise him to eat carbohydrates with meals rather than in between meals. He is unmet in the categories of fruit, vegetables, and dairy, so I would advise him to increase these food groups and also limit his meat products because he had a little bit of excess of meat every day. He consumed 2,145 calories on average over the course of the 5 days, and based on his age and his activity level, 2,200 calories is what is recommended for him, so he's just there. According to his risk caries assessment form, he has a few contributing conditions for a high risk of caries. So he doesn't have fluoridated water, which puts him at a moderate risk. He eats and drinks sugary foods in between meals. He does not receive dental care regularly, not since 2016. He also is taking multiple medications that have xerostomia as a side effect. Some clinical conditions are the presence of plaque, 2 interproximal restorations, He presented with some radiographically evident caries, which puts him at a high risk for caries. He has exposed root surfaces because of his gingival recession. He has a restoration with an overhang, puts him at a moderate risk for caries. Open contacts, which has the risk of food impaction. He has an implant, which is a fixed dental appliance. And he also shows signs of xerostomia, which is evident due to the left and right parotid glands being slow to replenish. According to his extraoral exam, he has crepatitis when palpating his TMJ. This may be a result of his chronic grinding, so I would definitely recommend a night guard again. So for his intraoral, he had type 2 and type 3 embrasure spaces on his anterior teeth of both dentitions and mainly type 1 embrasure spaces on his posterior teeth. He has keratinized tissue on the labial mucosa medial of the right cheek, keratinized tissue between tooth number 29 and 31, and he presents with linea alba on the right cheek, which indicates that he bites his cheek. He has yellow staining on tooth number 7, which is his implant, and on the mandibular anterior teeth. He has fractures on his mandibular anterior teeth, which may be due from clenching at night. He has food impaction between tooth number 7 and 8 because of his open contacts. His left and right parotid glands were slow to replenish, and the other glands were quick to replenish, but he has ropey saliva. And this may indicate that he is dehydrated, which makes sense because he is not taking in enough water per day. So he also has visible calculus on the interproximal surface of his anterior teeth and between tooth number 26 and 27. For his dental charting, I concluded that he had class 1 occlusion on both sides, and he has no midline deviation. He has no furcation involvement and no clinically visible decay. His tooth number 1 is impacted, so this may require tooth extraction, depending on if it is a concern for this patient. Tooth number 30, number 7, 14, 19 are extracted, and they're extracted due to caries. He has an endosteous implant on tooth number 7, and some contraindications for this is uncontrolled diabetes, heavy alcohol intake, anticoagulants, and the lack of consistent effective oral care. So I would make sure that he is adequately taking care of his implant and his oral cavity in general, and I would advise him to limit his alcohol intake and possibly have a medical consult because he is on an anticoagulant. He has 14 restorations. Tooth number 13 has an overhang on the mesial aspect. Tooth number 15, 18, and 31 are drifting mesially. He has attrition from tooth number 22 to 25, gingival recession on tooth number 3, 4, 29, 28, and 21 through 27. He has open contacts between tooth number 5 and 6, 6 and 7, 23 and 24, 24 and 25, and 25 and 26. His gingiva is fairly red and inflamed, rolled, and bulbous throughout the oral cavity, and it's blunted in the mandibular anteriors, and he has localized stippling on the maxillary central incisors, above the maxillary central incisors. According to his periodontal charting, he has generalized 2s and 3s on all of the surfaces of his anterior teeth of both dentitions, with localized 1s on the maxillary anterior facials. He has localized 5s on the maxillary molars and localized 4s on the mandibular posterior teeth. He has generalized 2s on the maxillary posterior teeth. All of his teeth have slightly improved pocket depths or have remained the same, except on the distal facial of tooth number 17 and the distal lingual of tooth number 15. He has localized bleeding on probing on the posterior teeth, mainly on the maxilla. And his bleeding on probing score was 50%, which indicates that his gingiva is inflamed. So I would advise him to focus his flossing and brushing on the posterior teeth on the left side of the mouth, since it seems to be where most of his deeper probing depths are. According to his periodontal disease risk assessment form, he has a few disease indicators such as existing and previous periodontitis of 21%, gingival bleeding of 24%, increased pocket depths of 1%, recession of 41%, interdental papillary changes of 54%, and radiographic evidence of bone loss of 69%. He has a few non-modifiable risk factors. He has a past history of periodontal disease, which is evident by his increased probing depths of 7 in his past perio chart. And he also is a male, and he is immunocompromised due to his diabetes. A few modifiable risk factors are that his self-care is good, however, there's always room for improvement for the health of his periodontium because there are signs of disease, and he also has signs of xerostomia. For local contributing factors, he has 1 restoration with an overhang. He presents with some calculus, 29% of his oral cavity. He has inadequate attached gingiva of 14%, and he also has occlusal trauma of 14%. In the occlusal trauma is his attrition that he presents from tooth number 22 to 25. On his radiographs, he has recurrent class 2 MO carie in tooth number 31 and class 2 root carie on the distal of number 6, and recurrent carie class 2 on the distal of number 4. He has generalized horizontal bone loss of less than 15% on all of his teeth, but he also has slight vertical on number 32, between 5 and 6, the distal of 29, the mesial of 31, and around his implant. He has root resorption on 31, and it seems like it's a poor prognosis for this tooth because it is drifting mesially, it's resorbing, and he also has a recurrent carie on this tooth. He has a slight overhang on the mesial of tooth number 3, which may be contributing to disease progression because it can retain biofilm. He has an endosteus implant on tooth number 7, and he has a radiolucency around the implant, and this may indicate that he has parafunctional forces that are compromising the integrity of the implant, so I would suggest that he gets a partial denture for the missing teeth and the mandibular teeth. His ADA classification is generalized stage 3, grade B. It's stage 3 because his deepest probing depth is 6, and he is grade B because he has controlled diabetes with an HbA1c level of less than 7%. So I have a lot of patient-centered goals for him. So I would want him to understand the effects of xerostomia on the oral cavity, understand the role of xerostomia in the caries process, be educated on the link between xerostomia medication and caries, understand the method and products that can help reduce the presence of xerostomia, begin using fluoride tablets or begin drinking fluoridated water bottles, incorporate 20% more copper into his daily diet, and also consult his doctor about possibly switching his medications to reduce his xerostomia, since a lot of them have xerostomia as a side effect. So the interventions for this would be to frequent professional debridement and application of 5% NAF varnish. A saliva substitute might be recommended. Increases hydration with water, ice chips, high moisture foods, and thin foods. Avoid using alcohol-containing mouth rinses. Avoid caffeine intake, and chew xylitol gum. Also nutritional counseling. I would have him brush daily with a powered toothbrush and a prescription fluoride mouth rinse and a prescription toothpaste. So for the mouth rinse, I would have him use Prevident alcohol-free. And for the toothpaste, I would have him use Clinpro 5000 1.1% sodium fluoride anti-cavity toothpaste twice a day. I would assure that he checks the side effects of his drugs, and I would also ask him about his consultation with his physician to switch his medications possibly. And I would also inform the patient that saliva is a natural buffer for acids and that contribute to the demineralization. I would also educate him on how xerostomia alters taste and how it affects the oral cavity. So to evaluate these goals, I would assess his knowledge of the information that we discussed at the previous appointment. I would question him about the regimens that he's implemented in his daily routine. And I would ensure that he consulted his doctor about possibly changing his medication to help with his xerostomia, and also see if he is aware of side effects of his medication. So for some more patient-centered goals, I would want him to understand the role of diet, saliva, and plaque in the caries process, understand the role in compliance and prevention of caries, decrease modifiable risk factors by decreasing one cariogenic snack daily, treat his caries within the next 3 weeks, and understand daily recommended products to prevent further caries by the end of the appointment. So for interventions for these goals, I would complete a full mouth prophylaxis and do a 5% neutral sodium fluoride varnish. I would ensure that he understands all of the information that we discussed or that were in his goals. And I would recommend a diet low in sucrose, fluoride supplementation such as a daily use of 1.1% neutral pH sodium fluoride gels for 5 to 10 minutes in a customized fluoride tray at home. So I would also want to make sure that he is using the prescription mouth rinse and toothpaste. And also I would recommend a chlorhexidine gluconate 0.12% 10 milliliter rinse for 1 minute each month. To evaluate these goals, I would assess his knowledge of the information that we discussed at the previous appointments, question him about his changes in his diet, and also about the oral hygiene products he now uses. For some more goals, I would want him to understand the lifestyle behaviors that can lead to an angina attack, understand precautions to take to avoid an angina attack and ways to be prepared for a future angina attack. And I want the patient to feel comfortable and have low stress. I would also ensure for intervention, I would assure that I use stress reduction protocol, and I would ensure that I can make the appointment as short as possible. I would explain that physical activity, diet, and stress play a role in his heart health. I would also explain that he should always have his nitroglycerin with him in case of an emergency, and to avoid an angina attack, I would explain the importance of making lifestyle modifications to prevent future complications. To evaluate these goals, I would assess his knowledge of the information that we discussed and question him about the lifestyle changes he's made. So for some more goals, I would want the patient to have a renewed confidence in his smile. I would inform him that coffee has the potential to stain his tooth surfaces. I would suggest a professional whitening treatment, and also his stains should be removed by the end of the appointment. So for some interventions for these goals, I would selectively polish only the stained surfaces with a tin oxide or non-abrasive toothpaste due to his dental implant. I would also have him consult with a dentist to discuss any cosmetic changes to match his crowns and his veneers. And also, I would suggest a professional whitening treatment. So to evaluate these goals, I would assess the knowledge of what we discussed at the previous appointment. I would ask him about his feelings toward his facial image, and I would assess the color of his teeth and ensure that there is no more visible stains. Some more goals are to acknowledge signs of gingival disease. I would want him to reduce his plaque index by 5% by the next appointment. I would want him to increase his daily intake of magnesium, vitamin D, and calcium by the next appointment. Seek regular dental care every 3 months. Eliminate bleeding on probing by the next appointment. Have his overhang smoothed, and also understand oral care regimens by the end of the appointment. So for some interventions, I would do a periodontal debridement, and then this would allow me to remove his overhang. And I would also recommend a controlled release drug delivery of chlorhexidine digluconate, which would be recommended after scaling and root planing, and this would be advised because of his increased pocket depths. And I would educate him about all of those things that were discussed in my goals, and I would inform him on how to modify his oral hygiene routine by showing him the proper techniques of a powered toothbrush. And also with a manual toothbrush, I would recommend the Stillman's method. And I would also recommend a rubber tip stimulator to help with his gingival recession. I would inform him that he should brush twice a day, and as he does now, for at least 2 minutes. I would suggest the use of those prescription, like I said earlier, the mouthwash and the toothpaste. And I would suggest that he modifies his diet by incorporating more magnesium, vitamin D, calcium in order to support bone health. To evaluate these goals, I would assess his knowledge of the information that we discussed at the last appointment. I would check his oral cavity for his restoration and any defective restoration margins, and check for bleeding on probing. I would question him about the changes he's made in his diet, and I would also ask him about the oral hygiene products that he now uses and demonstrate the use of the aids for me. Some more goals are to understand the impact of lifestyle behaviors on systemic health, understand the impact that sodium and alcohol have on his blood pressure, and emergencies that could happen with stage 1 hypertension. I would want him to decrease his sodium intake by 20%, limit alcohol consumption by 1 drink a week, and also increase 15 minutes of daily physical exercise. So for these interventions, I would explain all of the concepts that I just mentioned in my goals. I would recommend that he lowers his alcohol consumption by 1 drink a week, incorporate 15 more minutes of physical activity, and then I would advise him to lower his sodium intake to improve his hypertension. To evaluate these goals, I would assess his knowledge from the information from the previous appointment, question him about the changes that he has made in his diet and alcohol consumption, question him about the amount of exercise he gets per day. Some more goals are to understand the effect of occlusal overload of his periodontium and implant, understand the effects of bruxism on the dentition, be fitted for a night guard, and consult his dentist about getting a partial denture. I would for the interventions, I would educate him about the concept that I discussed in my goal for him. I would fit him for a mouth guard, and I would also refer him to a dentist to get a partial denture. To evaluate these goals, I would ask him about his dental visit, assess his knowledge from the previous appointment, and I would also ask about his frequency of wearing his night guard. So a few more goals are to understand the importance of daily biofilm removal, begin the use of a water pick, rubber stick stimulator, and a powered toothbrush for daily biofilm removal. For these interventions, I would inform him the importance of daily biofilm removal. I would inform him to use a powered toothbrush twice a day to help with his dexterity. I would recommend a water pick to use before specific cleaning with a toothbrush and auxiliary aids. And I would recommend a rubber tip stimulator, and I would use these aids twice a day. I would recommend that. And to evaluate this, I would question him about the products that he is using and the frequency that he is using them. And some more goals are to lower his sugar intake and make other dietary changes, understand the importance of managing his stress, and follow recommendations from nutritional counseling. So for these goals, my interventions would be to inform him on the importance of lowering his sugar and making other dietary changes because of his diabetes. I would advise him to lower his sugar intake, reduce his fats, limit carbs, added sugars, and refined grains. He should increase his fiber, fruits, and vegetables, whole grains, and low-fat milks. And he is deficient in zinc, which helps with poor wound healing, so I would suggest that he gets more zinc in his diet. And he should manage his stress levels by getting more exercise, adequate sleep, and continue to prioritize social activities and work, a good balance for that. And to evaluate these goals, I would assess his knowledge of the information from the previous appointment. I would ask him about his stress levels and dietary changes he's implemented, and ask him what his glucose levels are.